Salmonella is a bacterium that causes one of the most common enteric intestinal infections in the United States, salmonellosis. It has long been said that pioneering American veterinarian and scientist Daniel E. Salmon discovered the very first strain of Salmonella in 1885, when in actuality, Theobald Smith, the research assistant to Dr. Salmon, discovered the first strain of Salmonella, now known as Salmonella calore. Being the person in charge, however, Dr. Salmon received the credit for the discovery, giving rise to the bacteria's name and immortalizing his. In any case, today the number of known strains of Salmonella totals over 2,300. So what exactly is Salmonella? Well, Salmonella are defined as gram-negative, rod-shaped, facultatively anaerobic bacilli that can cause salmonellosis, a diarrheal illness in humans. Pathogenically, Salmonella are ingested in food and survive passage through the gastric acid barrier of the stomach to invade the mucus of the small and large intestines. It is here that they produce toxins that interact with the surrounding epithelial cells, stimulating the release of pro-inflammatory cytokines, which induce an inflammatory response. It is this acute inflammatory response that then causes diarrhea and may even lead to ulceration and destruction of the mucus itself. The bacteria can then disseminate from the intestines to cause more serious systemic disease. As for host defenses, both nonspecific and specific immune responses are active. Nonspecific defenses consist of gastric acidity, intestinal mucus, intestinal motility, peristalsis, lactoferrin, and lysozyme. Specific defenses consist of mucosal and systemic antibodies and genetic resistance to invasion. Various other factors overall affect susceptibility, but one thing is for certain: this little bacteria has to be ingested in high enough quantity to develop illness. As for the epidemiological implications, non-typhoidal salmonellosis is a worldwide disease of humans and animals, contributing to over 100,000 deaths worldwide each year. While animals are considered the main reservoir, the disease is usually foodborne. It can be spread from person to person. Salmonella that causes typhoid fever and other enteric fevers spread mainly from person to person via a direct vector and often have no significant animal reservoirs. Asymptomatic human carriers may also spread the disease without any signs of infection. To make matters worse, this little bacilli is a common diagnosis, with over 1 million cases spread each year just in the US and roughly 93 million worldwide. While salmonellosis may be easy to diagnose, in any acute form, such as diarrhea or febrile illness, the only surefire way to confirm its presence is by isolating the organism from clinical specimens, such as from a stool or blood sample. So if you've ever been stricken with a serious case of the runs, chances are this little guy may have been the culprit. And yet, as common as this bacteria's presence may be, there is yet to be an effective vaccine developed. For now, the spread of these little guys is controlled mainly by hygienic slaughtering practices of livestock and the ensuring thorough cooking and refrigeration of foods. Additionally, making sure to limit cross-contamination of foods and also washing your hands before and after handling any food are the most steadfast methods to limiting transmission. Remember, if you can keep these little guys from invading your kitchen, then you can keep them from invading you.